Tigers and guests, welcome to this very special Suncoast Tiger Bay event. My name is Amy Cianci. I'm the Executive Director of Suncoast Tiger Bay and your host for our first ever virtual panel discussion. Joining us, who you've already heard from, is Kira McGraw. She will be assisting us with the questions during the Q&A portion of the presentation. For those of you who are joining us for the first time, the Suncoast Tiger Bay Club serves as a civic commons where thought leaders and citizens of all political stripes come together to discuss the pressing issues of our time. These conversations are always important, but in these challenging weeks, they have taken on a new tone and a much deeper meaning. Even though we cannot be together at our regular monthly meetings, Suncoast Tiger Bay will keep the conversation going through virtual events like this one. Please help support our continuing commitment to bringing you timely and informative programming by becoming a member, renewing your membership, or donating today. A donation of $25 or $30, what you would have spent on a luncheon to come to a regular Tiger Bay meeting, will help sustain our club during these tough times and allow us to continue to keep you informed and connected to our community. We're going to go ahead and meet our panelists. Dr. Dumois is a pediatric infectious disease physician at Johns Hopkins All Children's Hospital. Our second panelist is Carrie Eisenbeis. She is the Vice President of Government and Community Relations for the BayCare Health System. And Adam Rudd is the CEO of the Largo Medical Center. Panelists, we know that your time is precious, especially now with what's going on in the world, and we thank each of you for being with us today and taking the time out of your busy schedules. With that said, we'll get right to the questions if everybody's ready. So the first question is for all panelists, and you could raise your hand if you want to jump right in there. We've seen the images of overcrowded hospitals in New York and other large cities on the news. How does Pinellas's hospital capacity look currently, and how are the projections looking?
Hi, everybody. Again, this is Carrie Eisenbeis. It's good to be here virtually. This is my first time with Suncoast Tiger Bay, so thank you, Amy, for having me. And it's great to be here with Dr. Dumois and Adam Rudd. I think it's a great question, and it's certainly on everybody's minds right now as the governor spoke out yesterday and has made some changes around his executive orders, and now hospitals are allowed to do elective procedures, and we're inching towards trying to move back to some level of normalcy. To answer your question, I think there's a lot of capacity in Pinellas County. BayCare has 4 hospitals in Pinellas County, and through rigorous planning over the last couple months, we really made some dramatic changes. We certainly haven't been doing elective procedures. And so that's created a lot of capacity. Our normal census in hospitals is down a lot compared to normal times. And so there is the capacity, certainly within our facilities, to do that. I think we've seen our community members really respond to the direction to social distance and really work towards flattening the curve. And so we've all kind of come together, and folks haven't been coming to hospitals if they could choose not to. So that's created a lot of capacity for us to respond to. I would add that some of that is changing a little bit in Pinellas County. We've seen, unfortunately, some outbreaks in our skilled nursing facilities. The elderly are very vulnerable to COVID-19, and we've had some outbreaks in Pinellas County. And so our census in our hospitals has changed a little bit over the last couple of weeks as some of these residents have come to our hospitals and others on the phone. I know our colleagues at HCA and Advent and other health systems have also helped take care of these community members. So that's changed a little bit of our current environment. We're going to need to pay attention to that. Our seniors are very vulnerable. And if we can continue to see outbreaks of that community, that will obviously have a direct impact on our capacity to respond.
Thank you, Carrie. Adam, do you have anything to add to that? How's it looking at Largo?
No, I think that it's very similar. I think that, if you look at the positive, or we'll start with the negative, I think the ER is kind of the most concerning thing for us. not only we mirror what Baycare has experienced on the inpatient side, but I think the one thing that I didn't predict in any of this is that our ERs are ghost towns. And, that is something that is at least concerning, given that, we've been doing this for 3 or 4 weeks, and we're starting to see the implications of that. Instead of you come in with chest pain, they're coming in for something very significant that sometimes isn't fixable. And I think that is a byproduct of the COVID fear that has been that's been really interesting to watch. When you talk, we get numerous phone calls a day of, is there any way if I have an emergency that I can come in because you're overrun? And that's just not the case. And I think that has been the one thing that has been surprising to me. And, our facilities, we have 4 in Pinellas County as well. And we're at capacity. We have plenty of capacity to handle whatever comes. I do think one of the things that's been positive about COVID, if there is something positive about it, is I have really seen a lot of collaboration between health systems. And, Baycare and us and HCA, can't agree on what day of the week it is usually. But, in this particular instance, there has been unbelievable collaborations between the health systems. The nursing home that she was mentioning earlier, there was a daily phone call with Baycare and HCA talking about how do we handle this together so we support our community. And I think that relationship moving forward is going to be something very positive for Pinellas County. And I'm looking forward to, the next partnership opportunity. Hopefully it won't be around COVID, but again, how do we serve our community as a health system? And I think that's something that's exciting to look forward to.
That's awesome. Dr. Dumas, I know that you have kind of a different view of this, being at All Children's. Can you let us know how this is affecting our children?
Well, we do not see many children with COVID-19. Apparently, most of the kids who are getting it, because we know that they get it, are either so mildly affected with minor cold symptoms or have no symptoms at all that we are not seeing it. We are testing children every day in the emergency room. And even then, we're only testing maybe 5 to 10 per day. And most of the time, all those tests come back negative. Our emergency center also has seen a significant decrease in volume of kids coming to the ER. We're seeing less of all the other types of infections due to social distancing. The kids aren't going outside and going to school, so they're not getting injured either. And we aren't doing elective surgeries. So we have a lot less volume than normal, and so we have a lot of capacity for caring for kids here.
That's great. The second question we have is open to all panelists, and this is about testing. Do we have enough tests here in Pinellas County? And do we have the appropriate amount of PPE here in Pinellas County to administer those tests to the people who need them?
Regarding the PPEs, at our hospital, we seem to have enough PPEs, especially with the masks, if we allow our healthcare providers to reuse the masks. These disposable masks are normally intended to be used once for interactions with a single patient and then discarded. And we are not doing that. We are trying to conserve them to some degree. One of the doctors here created a way of sterilizing masks using ultraviolet light in a box, so we can irradiate the mask to sterilize them for reuse. But we are starting to run short on some of our disposable gowns and are looking at using cloth gowns that will have to be washed. So we do not have plenty of PPEs to be used as they're intended to be used. With regard to testing, our testing situation throughout the county is a lot better than it was 2 months ago. So if you remember at the beginning of the outbreak, we could only do testing by sending specimens to the CDC in Atlanta. And they had a capability of maybe 400 tests a day for the entire country. But since then, it's been expanded to commercial labs like the big ones, Quest and LabCorp. We also are seeing that many hospitals, if not most hospitals, have some capacity to do testing within those hospitals. And that has greatly improved our ability to do testing in any sick patients. However, there are still barriers to testing. I think that it would be a good idea for anyone who's feeling ill to get tested if they want to. But in some situations, you have to get a doctor's order to get tested. Or if you want your test run at one of the major commercial labs, they won't collect the specimen for you. So somehow you have to get the specimen collected and then you can bring it to Quest or LabCorp and they will process it and give you results a week later. There are some of those drive-through testing centers where you make an appointment, but once the appointments are up, that's it. And you have to show up at a particular time to get your test run. But those are reliable and those do not necessarily require a doctor's order. So I think our testing capability could be improved, but it's a lot better than what it was.
Okay. Does BayCare or HCA have a viewpoint on that?
Yeah, I'm happy to weigh in on that topic. I think we've seen, if we just think back 2 months ago, we didn't have any testing capability in our region, in our state. And over the last 2 months, through a lot of persistence and ingenuity, we've just seen a tremendous response to, while it's not perfect, delivering testing, community testing. We, as healthcare organizations, we've figured out how to process our own testing internally. We worked through log jams with the commercial labs. Rapid tests have been developed. We're working on antibody tests. So there's been a tremendous amount of progress. Sometimes it's hard to think back before March. We feel like we're a little bit stuck in we're stuck in time. But I am very proud of the testing that's gone on to date. Since the beginning of March, BayCare has helped stand up 7 drive-through COVID testing sites. We've had a real community need to figure out how to begin to test community members. Today, we still have 3 drive-through sites set up, one at Carillon in Mid-County, and then we're also supporting the Raymond James community site in Hillsborough County. We've conducted over 17,000 COVID-19 tests. And so that's been a real learning experience and something that we hope will make a difference in people's lives. That model is a smart one because it helps us preserve PPE. It helps protect the safety of our employees in conducting the test. You don't have to re-sterilize a room. It's a very efficient way of conducting COVID testing. And it's something we've all learned. We've all had to be agile, learn how to do that. The question around how much and do we have enough, I think it's important to understand from a testing perspective that there's a lot of pieces to that puzzle. It's the test kit itself. It's the chemicals we need to process the test. It's the clinician. It's the instruments. And so all of that has evolved and morphed over the last couple of months. And we've all worked to develop capacity to be able to process those tests. And so I'm really proud of how we've evolved as a community and the technologies come forward. But it's a constant learning curve. And as we look at potentially testing more and reopening back and preparing for hopefully not, but potentially a second wave of COVID, that testing and PPE will need to continue to watch and monitor that because the supply chain, the availability of that is not, all those kinks are still not worked out. It's a work in progress.
Adam, does HTA have a viewpoint you'd want to share on this topic?
Sure. I think on the testing capability, yes, it has been an evolution over the last few weeks. I think that, you're right. As the panelists were talking about, it started with one particular area, and then you were going to the commercial labs, and then I think all the systems, we have, our own ability to test inside the system now. And even the rapid testing that's 4 to 6 hour turnaround time, again, all available to our hospitals. And I think that's been a huge advantage. And I think, as the physician was recommending, I think that we will be moving toward, at least testing a lot of the patients that come in, especially anybody for elective surgery, which the governor's unleashed for Monday. But, before we do elective surgery, I think that we're going to test any of those patients that come in. As far as supplies and goes, I'm in a little bit different situation than everybody else. We're part of a huge company. It's the largest hospital chain in the country. And I think that we have been able to do things on a macro level and move things where they needed to be. From a PPE perspective, we have been conserving PPE, but again, have plenty of everything. And I think as All Children's was describing, the N95 mask has kind of been the hottest commodity. But again, I think that we have spent, we're issuing, several each day to those affecting those COVID patients. We are reusing them on a 4-hour cycle, but after that, we're not reprocessing or anything like that. And all the other equipment and gowns and things like that, we have been very fortunate to have plenty of all those things.
Thank you all. The next question we're going to direct to Dr. Dumois, and it kind of expands on this idea of testing. In regards to antibody testing, which we're hearing a lot more about, reinfection and immunity, can you tell us the latest thoughts of what kind of immunity people who have been exposed to the virus might actually have at this point and what we know? And if we think the antibody testing is effective and if it could possibly help recovery for those patients who are testing positive.
Okay, I'll briefly explain what antibody testing is. Antibodies are proteins produced by our white blood cells once our white blood cells have recognized that we've developed an infection, so that in the process of trying to fight off that infection, these antibodies are produced. In the antibody test, we look in the blood for the presence of antibodies that were specifically produced to fight a particular organism, in this case, the SARS coronavirus 2. And we know that that's what those antibodies are for. So the antibody test is not a test that's used for the patient who walks in sick to see if they have COVID-19. Because from the time that I'm infected and have COVID-19, it can take a week or two for my blood antibody test to become positive. So if I test too early in the illness, I will have a false negative result because there hasn't been enough time to produce antibodies. The antibody test, therefore, is not used to diagnose whether somebody has COVID-19, but whether they had it. And if the test is positive, that means they probably had it at least a week or two ago. It may have been 4 months ago. And in the future, we might even be able to say sometime in the past, even years ago, because these antibodies can persist for years as a sign of ongoing protection from that previous infection. Now, what we don't know is how well do these antibodies in our blood after we've had COVID-19 protect us from catching it again. For some infections, the antibodies protect us really, and you can have like lifelong immunity and never get sick with it again. With some other infections, we have not so good protection, and you can get reinfected with either the same organism or different strains of the same organism in the future. And that's what we do not know the answer to. And so when there was that controversial statement by the World Health Organization last week that scared a lot of people about antibody testing, what they said was technically accurate, that we do not know how much these antibodies will protect us from getting COVID-19 again. However, the assumption is that there will be some protection, because with most other similar types of illnesses, we do see some level of protection against getting it again. So what's it going to take for us to know that antibodies protect us? You're going to have a research study that gets together a bunch of people who have antibodies because they were previously infected, and follow them over the course of the next several months or year as they get re-exposed to COVID-19 and see, do they get sick with it? They'll compare that group to a group of people who don't have antibodies and see how often they get COVID-19. So if the group with antibodies gets COVID-19 less frequently, hopefully zero, compared to the group without antibodies, we can then say it's that protective, and we can even give it a number as to how protective those antibodies are. But that there hasn't even been enough time elapsed where we could begin to see results from a study like that.
So what's the normal timeline to get into that kind of science in a typical scenario?
It's usually a minimum of 6 months to a year, depending upon in the research study how long they decide to follow the patients with or without antibodies for symptoms of illness. And every time they get sick, they get tested for COVID-19 because they may be sick with the flu or something else. So we need to see how often they actually get COVID-19. The longer you go, the more accurate it is. And it also tells you how long the protection lasts. So for some infections, you may be protected for a year or two, and then the protection wanes over time. So we will probably be seeing research about the protectiveness of antibodies over time going on into the next several years. But we may see something as soon as 6 months.
So it sounds like this is something that COVID-19 is something more like the flu that we're going to be living through seasonally or over and over again. This is something we're going to have to continually be on the lookout to protect ourselves from in the future, rather than the idea that we've had it, we're good, we're all moving on. Is that accurate?
No, it's a guess, but I don't think we have enough evidence to say that it's going to be a seasonal problem. And the reason is that we don't have a vaccine yet. But when we do have one, it depends on how effective the vaccine is. Is it a vaccine that you take once and you're good for life? Or is it a vaccine that you're going to need boosted like the flu vaccine? We don't know how many people are going to accept the vaccine. So 10 years ago, when we had the big influenza pandemic, only half of the people in the United States accepted getting the new pandemic flu vaccine. So we may see a similar problem of low vaccination rates once the vaccine comes out, whenever that is. But if you have good uptake of the vaccine by people who have not had COVID-19, you could completely prevent coming back as a seasonal thing every year.
Thank you, Dr. Dumois. That's very good information. This question is for Carrie and Adam. Governor DeSantis, we've talked about this a little bit. Both of you have mentioned it. Governor DeSantis just yesterday has lifted the restriction on elective surgeries beginning Monday. Are hospitals ready to resume some semblance of business as usual? And how will hospitals protect non-COVID patients when these services resume?
I'm happy to jump in there. I think, as you said, and we all learned last night, our world order is changing. Monday, we can begin doing elective surgeries. We certainly had been planning for this announcement. Nobody quite knew which day. And so now we know, and we've been working hard to make sure we can meet so many of the healthcare needs that have been delayed with the elective surgery order in place. We all know somebody who's desperate to get their knee replaced or hip replaced or something else even more emergent. And so we're ready to get back to business and meet those health needs. And there's been a lot of planning to make sure that's as seamless for our community members as possible. We need them to feel comfortable to come back. We're ready to serve them. It's our business model to make sure that we are making our environment as safe as possible in a COVID environment or any other environment. For the last 2 months, we've all been working to make sure our COVID patients are cohorted or separated in an area where there's not commingling with other patients. So those are practices we all have in place today, and we will obviously continue. I mean, just to give you a couple of examples of things that we will have in place now, where people can feel like it's going to be business as usual and they can come back to hospitals. We will continue all of these processes we put in place. We will continue screening individuals when they come through our hospitals to make sure those that may not be well can't come in. We don't want to create or spread any sort of infection. We all have cleaning processes in place, and we have all ramped those up to make sure that everything is sterilized, including treatment rooms and patient areas, to keep the cleanest environment possible. We all added new enhanced PPE for our employees to make sure our employees are safe as well as our patients. Practicing social distancing, things that we've started that a lot of us didn't do around using our smartphones or apps to communicate to organizations, remotely. We're going to allow patients to be able to check in online before they walk in, and reduce that amount of time where they're actually waiting for a procedure or process. Certainly, there's testing for people who are going to have surgery and making sure that we know the status of someone before they come in for a procedure. That's certainly an important thing that didn't exist 2 months ago. We didn't have COVID. So there's a whole number of things that we've all started and that we will continue next week when we're allowed to get back to business as usual.
Adam?
Yeah, and I completely agree with what she's saying. I think, one of the things that it has been eye-opening for at least me is healthcare is all that I know, is how different the world was during the non-elective surgery phase. And, it's easy from the outside to think, well, it's elective surgery, so it doesn't matter. But it really does. And, the examples Carrie used around hip surgery or total knee or something like that, these folks are in pain. And a physician has decided that they need surgery to keep their life in order. But, their cath procedures, cardiac cath procedures, their GI procedures, there are all kinds of things that we do to diagnose this or that has been delayed. And I think that those are kind of the things that are a little bit unnerving because what do you get? When they come in to do it again, is it worse? And I think that that's kind of the clinical angle on that. And I think for us, as far as what are we doing with the hospital, we're doing exactly what Carrie mentioned is, we're doing the cohorting. We've got extra PPE for people that come in, that we're masking everybody. The screening continues. It's interesting. For me, I don't know that there is a safer time to be in a hospital. 6 or 8 weeks ago, when you came in a hospital, people weren't masked. Everybody that walks the halls is masked. When people come in, the visitors that are coming in, we're testing you ahead of time. If you get in, you've got to pass the screening test. And so I think that we are at Cat 5 as far as preparation goes. And I think that that's going to be something that continues. And, as we look to how does that change the world, I think that's one of the things that I'm really curious to see as we've restricted entrances and we've restricted visitation. And we've done a lot of things that seem fairly draconian to protect the current patients in-house. What pieces of that do we find on the long term that are things that maybe we need to keep the patients safe? Because, I think the one thing about COVID that is a little unnerving to me personally is there a COVID 20 or some version of that is sitting for next year ramp up? And how do we start thinking about how we do everything a little bit differently? And I think, for the system standpoint, and I know BayCare is thinking the same things, is, what are we trying to do to get ahead of kind of the next whatever, so that we're not caught flat-footed again, kind of like this year, where we come into this and the whole world has to be changed. And how do we keep some of these things in place so that we're safe all along the way? Whether it is PPE or all those things as we come through that. And I think that's going to be the lessons learned. And I hope, again, that partnership that we have as a health system with BayCare and with the Advent and, All Children's and Tampa General, that we continue through all that to make sure that we're kind of providing the same and consistent care across all of our systems so that our community is safe. And I have seen more cooperation around that kind of discussion that I think is really going to benefit the community going forward.
Thank you all. This has been really great. I just want to be mindful of our time because we want to open it to Q&A. While we're having the questions sort of roll in here, I'm gonna hand it over to Kira, and we're gonna just start taking some of the questions that we've been getting while you guys have been discussing all these topics over the course of the last few minutes. Kira, do you want to take a look at our questions and let us know where we want to start here?
Sure. Let's see. We've got some good ones in here. Can we speak to the length of how long it takes to get results from a test? What is the average time? And is there a reason why it takes that long to get tests? People were asking if it takes a week. Is there a shorter period of time?
I can answer that. So some of the tests do take a week or more, and those are usually the ones that go to the commercial labs. So when specimens go to Quest or LabCorp, and when these labs developed these tests, they first thought that the turnaround time would be about 2 days. but they've gotten so inundated with specimens that it's created a backlog. And so that is why it's taking a week or more in some cases to get results back, because they just haven't even gotten to your specimen until days after they've received it. That's how busy they are, even though they've hired extra staff to run these tests in their labs. There are other lab modalities for COVID-19 testing that are faster. A lot of the hospitals are using a test that you can get results back in about 4 hours. There's another test that's run in some hospitals that takes about 1 hour. And then there's been a lot of publicity about the 15-minute test that came out a few weeks ago from one of the manufacturers. So we would ideally like to do all the tests very quickly and have results back in an hour or so. And what we try to do in our hospital, we can do the 4-hour test and we can do the 1-hour test. However, even though we would like to do all the tests in an hour, we don't have enough kits sent to us from the manufacturer to do all our specimens on the 1-hour test. So we have to prioritize. We triage the reasons that a patient is being tested and do the highest priority patients on the 1-hour test and the slightly lower priority on the 4-hour test. And there may be extremely low priority tests that might get sent out to a reference lab. And I think all hospitals are having to do that sort of triaging depending upon the testing capability they have in their own labs. With regard to the 15-minute test that you've heard about, many hospitals have decided not to adopt that one because it looks like that even though it's a fast test run on a relatively simple machine, that it's giving us a lot of false negative results. In other words, people who have COVID-19 are coming up negative on that test more frequently than with the other tests.
Thank you, Dr. Dubois. Next up, given the history of race discrimination, it's not really a surprise that COVID-19 has had a deeper impact in race-vulnerable people and communities. Are we balanced in our testing to be sure that we have penetrated the 1.3% current testing rate, representing the current rate of disease for Blacks, which is nearly 50% higher than whites, and for Hispanics, who have a 60% rate? How can we do better at targeted testing of those most vulnerable by rate as assessed by race? And they're stating the data came from Florida Department of Health and USF.
I honestly don't understand that question. I'm sorry. But the second question, I think, is one that I understand a little bit better about how can we improve accessibility of testing to minorities.
Yes.
I think that most people believe that there is insufficient testing of minorities. And that may be part of the reason why that we see increased severity of illness in patients with COVID-19 who are African American or Hispanic, because only the sickest ones are coming to the hospital to be tested. Whereas people who have may get tested or go through one of these drive-through testing centers because, for one, they have an automobile and can get there. If there's a copay through their insurance or there's a fee to be paid, they can pay for it. And so I think that in general, access to healthcare has always been a challenge with ethnic minorities, and that situation is exacerbated with the current COVID-19 pandemic. Another problem with access to healthcare is that when you do get sick, you wait to go to the hospital until you're really, really sick. And so if you wait longer to get to the hospital, you're more likely to not survive a severe illness than if you showed up earlier. And that also has been a regularly recurring theme over the years for people of lower socioeconomic status.
I would just add to that, I think it's a really legitimate concern, and it's a community discussion point right now. And, I think we're not working in a perfect environment. There is testing access, but it's in specific areas that may not be easy for everybody to reach. So I think it's been a real focus of our local government. I know in Pinellas County and the departments of health across a region on how to increase access. And I know there's been some pop-up testing and things like that. And maybe it's not meeting the true need. It's a work in progress. And I know our local government partners are trying their best to meet that need right now.
Thank you. If someone is immune, can they still be a carrier and continue to shed the virus?
I would say that if you want to define immunity as having antibodies, then yes, you can have detectable antibodies in your blood and still test positive for coronavirus in your nose. And if you're testing positive, you might also be contagious because there's an overlap there. Antibodies may appear as soon as 2 weeks, 1 or 2 weeks after you get sick with it. But some studies are showing that people may continue to test positive in their nose for 3, 4, or 5 weeks after they got sick. So there is an overlap there.
What percent of the Pinellas population do we think has been tested, and what percent do we feel we would need to test to really know who has it and who does not?
I'll try to answer that. I have no idea what percent of the population has been tested. I have not. I would have to look up current population numbers and compare them to the testing numbers for Pinellas County. I'm sure those numbers are available. As for the question of what percent would have to be tested to know how much there is out there, to know completely everyone who's been infected, you would need to essentially be testing everybody in the county at least a couple times a week. That's not practical. It's not feasible. It will never happen. So I think the next level that approaches practicality is trying to test people who are sick. We know that not everyone develops symptoms, so we're not going to catch everybody. But if you can test everyone who's been sick, and then you can find that a certain percentage are testing positive, maybe it's 10%, it might be more or less than that in certain communities, then you can identify who's been infected and begin contact tracing, if you have the personnel in the public health department to do the contact tracing. And what contact tracing means is you call the person whose test came back positive. You ask them, who have you been around in the last 14 days? We would like to contact them and tell them that they've been exposed. And when they contact those contacts, they will say, you've been exposed to COVID-19. You may want to isolate yourself in quarantine for 14 days from the last time you had contact with this person who's positive. That's what they did in South Korea without shutting down the country, and they kept it under control that way.
Thank you. Next up, can you speak to other countries such as Sweden that chose not to impose restrictions and how they have fared?
No. I can't because all I know about the details of Sweden is what I've seen on the news. I have not seen the details of what's been happening in their emergency centers and intensive care units. I have not seen specific numbers regarding numbers of tests and percent positivity and the death rates in the different bigger cities in Sweden. You really want to know all of that to answer that question correctly.
Amy has one last question that she's going to bring up.
Yeah, again, we're being really mindful of time, and we know how busy everybody on this panel is. And again, we thank you all so much. I think we'll just go right across the panel here and start with Carrie on this last one. It's sort of an outlook question. Obviously, none of us are going to know what our new normal is until we start we start getting back open and getting back up and running. But how are the individual hospital systems preparing for this ongoing battle, and what will this look like as you start ramping up the regular hospital services along with still battling this COVID pandemic?
Sure. Yeah, I think we aren't under any illusion that we're done or we will be done in any month or 2 months with COVID or whatever follows it. And so all of our planning and a lot of our efforts are really going beyond the next quarter. They're going through the end of the year, anticipating potentially another wave of COVID and how to respond to that. Trying to reflect back on what we've done over the last 2 months, what's worked. In this environment, we've had just great opportunities to test new technologies and build capacities that we didn't even know we needed. I think a great example of that is telemedicine. In the last 2 months, we have seen the value of telemedicine in delivering and assessing healthcare in a way that we never have as a community before, because that was a very important option. So I think as we look forward, some of these tools that we've had, they will be accelerated, and we'll continue to use them in a way that will make the healthcare experience more efficient, more safe, and more effective. So we're looking ahead. We're planning for the worst case. We're anticipating that this could come back. We're making sure we have the supplies, the materials, the staffing, the expertise to be able to continue to respond effectively to COVID. And we're hoping to really tap into these technologies and advancements that we've all been a part of over the last 2 months to help us do that. And I think telemedicine is a great example of something that's accelerated, and then we'll probably, as healthcare providers, utilize even more going to the future. And I think that's a great development out of what's been a very challenging situation.
Thank you. Adam?
Yeah, and I think just to kind of think through the future, I think, in the future for me, looking out over the next 3 or 4 or 5 weeks, what I think that for Pinellas County, especially when you look at the number of individuals in these high-risk homes, whether it's an ALF or, some sort of skilled nursing or rehab, we have a large number of individuals in these homes. And I think that's something as a community we've got to keep a really close eye on, because that is the risk for the hospitals looking out in a second wave. I mean, while it is tragic that we did lose some lives in Pinellas County, COVID, for the most part, has really been kind of a non-event for the hospitals as far as being overwhelmed or testing the system. But a couple of outbreaks and that could really change. And I think that is going to change how we plan for the future. And I think exactly what Carrie said is, thinking through this is now our new normal, and that we will spend, an amazing amount of time thinking through what are some of the technologies that we can use to deliver care in a different way, but also be nimble in a time that we have to adjust. And I think there's some really positives that have come out of this. One, and I think every health system saw this, you saw just unbelievable heroes in your staff. And I think for everybody on the line, if you see a nurse or a caregiver or a housekeeper or a food service worker or, pick your specialty, anybody with a hospital badge on, they were unbelievable through this. And we took their world and just turned it completely upside down. And I think every hospital has these stories, and I think truly they are heroes. And I think that's something that our system or our culture had lost. I don't think that we saw those guys that take care of us when we're sick as heroes. And I think that's something moving forward as a system, but also as a community we need to change. And I think, can we deliver healthcare in a different way? Is it technology? What are the ways? And, the question that was asked earlier around, some of our minorities and some of those that don't have access, how as a system do we address those issues? It's a great question. I think it's a tough answer. And I think we have not been as proactive as a community addressing those. And I think the last thing, with our vulnerable population that we're not talking about, that didn't get COVID, but our psychiatric population, in the middle of this, they're kind of cast aside because we're focusing on the sick. And these are also sick patients. And I think that's the other kind of thing that we need to think about. There's the COVID and the infection that we need to address, but there's still a lot of sick people out there that we need to address in a different way. And I think, especially in Pinellas County, when you look out, we have an elderly population, but we also have a very large psychiatric needs in our population. And we need to make sure we stay focused on both. And I think that balance will give us a really good healthcare system in the future. But I do think one of the really positive things that happened is the healthcare system in Pinellas County as a whole stepped up together. And I think that we were able and would have been able to handle an influx that they saw in some of these hot zones. Fortunately, we didn't have them. And fortunately, we won't have one of the healthcare or the SNFs or something blow up over the next few weeks. But I think we as a system will stand up again if we face another crisis.
Thank you, Adam. Dr. Dumois, you want to tell us what it'll look like possibly for all children?
Because we haven't had much of an impact of COVID-19 directly on our patients, we're going to be seeing things opening up, hopefully, as we've heard from Ms. Eisenbeis and from Mr. Rudd, that as we start reinstituting elective surgeries, I think that will increase our volume of patients in the hospital, of course. I think that whenever we start seeing the relaxation of the restrictions in society, people start going out again to restaurants and to stores. And even whenever schools decide to open up, if that's in the fall, we'll see more transmission for sure. Children may be the vectors that transmit viruses to their families that are more likely to get sick from it. And once they go back to school, they'll start getting injured and they'll start catching other types of viruses. So everything's going to get busier whenever kids start going back to school. And as long as we monitor that and look at our hospital capacity as we go along for the Pinellas County area, and again, all localized geographic areas should be looking at their numbers as things go along. We may see an increase of COVID-19 cases in the fall. But as long as our hospitals can continue to care for the sickest patients, and they're not running out of beds and they're not running out of ventilators, that's expected and it's okay.
Thank you all. I think we're gonna end on that note. On behalf of the board of the Suncoast Tiger Bay Club, I want to thank you each individually for taking the time to join us. I can speak personally, and hopefully I speak for a lot of our participants today, that this has been extremely informative. You have all kind of filled in a lot of blanks for me, and hopefully for a lot of the people here locally who've been watching the news but are just curious of what it was looking like on the front lines in our hospitals. And I have to say, I am just so grateful and amazed that our hospital systems are cooperating with each other in such a great and symbiotic way. That is wonderful news, and it's great for the future of medicine on a local level. To all of our participants, to everybody who logged in today, thank you so much for joining us. Thank you so much for taking an hour out of your day. Please remember to go to the Tiger Bay website, donate so that we can continue to bring you this great programming. And everybody stay safe, stay healthy, and thank you all for being with us this afternoon. Have a wonderful day.